what page, or you can just kind of, I guess, tell everybody a little bit about yourself first, and kind of how you came about working with the Interstate Compact and things of that nature.
Sure. So my name is Susan Adams. I am the Director of State Legislative and Regulatory Affairs for ASHA. So I work on the state affairs team, and I cover the Northeast region of states for ASHA. We have 4 colleagues on my team, and we cover different regions of the country. But I also, my kind of expertise is in licensure, and working with states on licensure issues and tracking licensure issues in laws and regulations among the states. So probably about 5 years ago now, we'd always had members come to us and say, why can't you make it easier for us to get licensed across state lines? And our excuse was always, well, we're not the state licensing board, so we can't really affect how they determine what license you need or how you need to be licensed. But then we started thinking it through a little bit, and we heard about interstate licensure compacts that were starting to pop up in other professions. So the nurse licensure compact started over 20 years ago. And they're going strong. They're still not a 50-state compact, but they're in the 30s, near 40s. So, we thought, well, like maybe we could do something like this. So we got a group of stakeholders together in 2017, and that was made up of state licensing board representatives, audiologists, speech language pathologists, state legislators. We had a representative from the Department of Defense there. And ASHA was there, and we got together with the Council of State Governments, who has a National Center for Interstate Compacts. So this is kind of what they do. They help people develop interstate compacts. So we got together, just to try to figure out, like, is this something we could do, And the advisory committee came to the agreement that, yeah, we could do this. So ASHA had signed a contract with the Council of State Governments to help us develop an interstate compact. So that's kind of how ASHA got involved. We've just been the funder of the effort. But we do work very closely with the Council of State Governments to get legislation passed in the states to adopt the interstate compact. So we've been working in state legislatures this is our 3rd session now. And we've just been working with them to help pass legislation. We are now to 18 states that have passed the interstate compact. And now the Compact Commission is starting to take over the role of running the compact. So they had their first meeting in January of this year, and they're going to have continue meeting. We actually have a meeting tomorrow for the executive committee of the commission to talk about how to get this thing up and running. So they have to, they're a supra-state sub-federal entity. So they have to come up with rules and bylaws as to like how they're going to operate. And that's what they're kind of in the middle of doing right now is creating those rules and bylaws and finding out how they're going to fund a database to have the information available so that people can actually use the compact.
Right. It's a very layered approach, I would think, going from each state to each state. Is that pretty challenging, dealing with different regulations, I would think?
Yeah, I mean, each state has had its own issues, I would say, in getting the bills passed. But, we also have to develop this database that's going to talk to all the states so that state licensing boards can find out what's going on in other states and find out who has a privilege to practice in their state. So that's kind of the next step that we're working on.
Right. Trying to find that common ground, I guess. So how are you approaching the next step? Getting all the states to somewhat communicate on some type of common ground. It seems very challenging to me.
Well, I think, it was really easy, I think, in the beginning because all of the states pretty much have the same licensure requirements. So we know that all the SLPs have to have a master's degree, and they have to do the clinical practicum, they have to do the clinical fellowship, and they have to pass the praxis. So every state requires that except for North Dakota and Missouri. So technically those two states are not eligible for the compact until they put a clinical fellowship requirement into place for their state license. But that's something we're working with those individual states on pursuing. But it's been a little bit easy, at least because we do have kind of a level playing field among the states. So it's just the question of getting something set up so that they can talk to each other.
Right. I guess I'm looking at it from somewhat of the teletherapy perspective, and that's kind of what I've been doing the last couple of years. And obviously this is the main topic of the group, and teletherapy is so new. So to me, that seems the challenge, right? We have the specific parameters of being a speech pathologist and abiding by the rules, but teletherapy is such a gray area, and each state seems to have its own regulations per se. I guess with ASHA being at the top, and that's where it gets a little somewhat complex, I guess.
Yeah, and one of the great things about this compact is that it specifically requires states to allow for teletherapy. Okay. So, we know that some states regulate it very well. They have very robust regulations around it. We know some states say nothing about it.
Right.
And then there's kind of all the variation in between. So, this compact says you have to allow for teletherapy. From out-of-state practitioners. And then if the state wants to regulate it in some way, then they can do that. If they don't have any regulations in place, then the compact will simply tell them that you have to do it. And ASHA has always viewed it as just another mode of service delivery. There's nothing special about teletherapy other than, it's this kind of, interaction. But the compact just says that you have to be able to do it. You have to allow people to do it.
Right. So I think what a lot of people, as being a speech pathologist, I see in the different groups, there seems to be a lot of opinions and challenges of licensing, and we're all very happy that you guys are doing this for us, and we know it's difficult. As far as being licensed in different states and the challenges that speech pathologists have, would you say that, this might be a challenging question for ASHA, would you say that ASHA has the final say, or is that actually left up to the states when you're dealing with specific? Go ahead.
Yeah, I mean, for the compact, it's completely up to the states. Okay. The compact commission is made up of the states. ASHA has a role as an ex officio on the executive committee, and that's a non-voting seat. So, we're just there to kind of offer our expertise, if they have questions, but the commission itself is made up of an audiologist and a speech language pathologist from every member state. So they have absolute say on everything that happens within the commission. Okay,
that's great. So let's look at the map here. Can you kind of let us know? I mean, this might be somewhat trivial, but like what is the red color and what is the blue color and the gray color?
So the gray color is the states that have not introduced bills. The red color are the states that have bills introduced this legislative session, and the blue states are the states that have passed the compact. Okay. So in the first year, we had 6 states that passed. Last year, we had 9, and so far this year, we've had 3 states pass. So all those red states are still kind of maybe in play. So, we're definitely hoping to get some more states past this legislative session.
Okay. Awesome. So that's great. Looks like it's moving really fast. That's pretty cool. So how about go through the process? Say I am licensed in Georgia. I'm sitting in Georgia and I would like to practice in one of the blue states. Um, what would be the process of maybe trying to figure that out, and how easy would that might be?
So once that database is up and running, the idea is that you as a practitioner would go into the website, this ASLPcompact.com website, and there would be a link there for you to say, I want to get a privilege to practice. And you would click on that link, you would just fill in some information and tell them that you want a privilege to practice in whatever state, whatever other member state that you want to practice in. And so the idea is that it would take minutes to just get that done, rather than days, weeks, months, if you had to go through the whole licensure process. So it really, the compact is an agreement between states. It's a contract between states to say, I recognize your license, and that's good for us. And you don't have to show any of that primary source verification for that. So, it takes away all of the grief and anxiety and, of waiting to get your license.
Right. Time,
you would have,
money.
You would have to pay a fee to the compact itself.
Right.
And a fee to the state where you would get a privilege to practice. But the idea is that those fees would be less than what a state license would cost you. So it would, save you money, but also save you a lot of time and effort.
Right. And it kind of adds up. The prices do, as a speech pathologist, that in, like states like California can be up to 6 weeks, I think, to get licensed.
I've heard months for California lately. So
like most things nowadays, it's probably even longer. So that's great. That's really awesome. So is there anything else you would want to say about the map, or that you think would be good for a speech pathologist to know? Or
well, I think if you're interested in helping with the legislation, you can always contact your legislator. On ASHA's website, on ASHA.org, if you go to our advocacy page and you click on the Take Action link, there's a generic take action there. So if you're any state that's not blue, if you live in one of those states, you can take action there and send a message to your legislators, letting them know that you support the Interstate Compact. Get in touch with your state associations. They really are our boots on the ground that are doing the work in the state legislatures to get these bills passed. So, connecting with your state association to find out how you can help there. And then, just staying abreast of what's going on, keeping on top of where we are and just being involved that way.
Okay, great.
I know
I was going
to mention, under that compact toolkit link tab there's a bunch of information. So if you wanted to have a discussion with your state legislator about the compact, if you scroll down, you'll find fact sheets and issue briefs and descriptions of the legislation and FAQs. So it's basically like everything you've ever wanted to know about this interstate compact, you can find in this information. And we really designed these to be shared with legislators and with state licensing boards to let them know exactly how the interstate compacts work.
Great. So are these PDFs that you can just download right to your computer?
Yep. Mm-hmm.
Okay. That's awesome. Yeah, you guys have done really well with the website and the ease of it. It's good.
And if you click on the commission tab where it says ASLP IC commission, those are the links to the meetings that we're having. So all of the meetings are open to the public. You can register to attend any meeting. And right now, all the meetings are virtual. So if you want to attend, you can click just to register for the meeting, and you'll get a link from the Council of State Governments to log into that meeting. So, it's really a transparent process. You can always see what the commission is doing and what kinds of decisions they're making. And just, like I said, keeping abreast of what's, where we are in the process.
That's great. And so right now it's just you and another audiologist that is heading this up?
So right now it's the commission, the ASLP IC commission has been established. They have an executive committee
Okay.
of seven members. So they're doing kind of the work of getting everything established. ASHA still has a contract with the Council of State Governments to continue the work of passing legislation. So ASHA will still be involved in that side of things of just continuing to pass legislation in the states. But the commission itself will really be the one taking over at this point and making all of those decisions as to how the commission will operate.
Okay. So I do have one question. So as far as if you were looking at what has worked so far on bringing on new states, like what would be something that us as speech pathologists could do that you've seen that has worked well in the whole process of things?
So just recently in Idaho, one of our members who is on the Idaho Speech Language Hearing Association board, so the state association board, but she was just doing this kind of as an individual SLP. She contacted her legislator, her state representative in Idaho, and just had a talk with him and explained this compact to him, how important it was to the professions, and he decided he was gonna introduce the bill. And so she's been, she worked with him mostly on getting this bill through the legislature. She went to the committee hearings, she testified on behalf of the bill. She provided all the information to the legislator. It was like really a one-woman show of just getting that bill passed in Idaho. So, really like cultivating those relationships with your state legislators. And letting them know, that this issue is important to you and how it can affect, better access to care for those with communication disorders, and how important, personal stories are always the best to share and let them know how important this is to you. So I think that's, if there was any takeaway, that would be the takeaway is, get to know your legislators. Let them know of the issues that are important to you.
Right. Kind of a boots on the ground, establishing relationships. Yeah. I mean, that's one of the hurdles, I think, not only for speech pathologists getting a position, but also children getting, therapy intervention. I think the licensure can hold that up, in a lot of ways.
Well, I think especially during the last couple of years with COVID, a lot of kids had to go without services for a long time because of, the whole glitch in the teletherapy process of, now these children are not in my state, they're somewhere else quarantining during COVID. And how do I continue providing those services when I don't have a license in that state? So, if the compact had been into effect already, we wouldn't have had all of those issues that we did have. So I think that just is more of a reason to get it passed now, because hopefully this won't happen again. But if it does, we would be prepared for it. Right,
exactly. And there still are a lot of areas that are in high need, even after COVID. So, I mean, I think it's really a great thing. I see we have Elena here, and I think she has a question. Let's see, is there anything else, Susan, that you think that would help us? We went over the toolkit, we went over the map. This commission is a really good way to get involved and hit the meetings. The supporting organizations, is there anything here that is relevant?
So well, we started that like kind of right in the beginning of, we're trying to show legislators that we had support. So, we kind of reached out far and wide to national organizations who, would ally with us and support us having an interstate compact. So the supporting organizations are all national organizations, they're state organizations. universities and colleges, and some individuals who have submitted letters of support. So, when you're, again, if you're having those meetings with your state legislator, you can point to this page to say, look at all these people who support this issue.
That's great. And maybe we could contact them and, get some help from them. Let's see here. So to get involved, this is kind of what we've been talking about. Would there be any reason to contact you guys or just direct to the legislators? Or
yeah, so this contact page will go to myself and the Council of State Governments. And so it's usually for people saying, what is my state doing? How do I get involved? And then we'll let them know, for their state specifically, what the status is. But again, if you go to ASHA's homepage and go on our Take Action site, you can reach out to your legislators directly that way. Okay.
Awesome. Yeah, I believe I contacted you guys through there, and it was very nice of you guys to get back in touch with me. And this page, the homepage, just kind of goes over, defines what it is, and okay.
Which we need to update, because I see that we still say 15 states, and in the last 2 weeks we've had 3 states that have joined now, so we're at 18 states.
Wow, that's awesome. Now, this is a kind of changing directions. Is there other fields that are doing this as well in allied health, or is it just speech pathology?
No, so we were the 7th interstate compact that came into existence. There are now 9. So we have nursing, the physicians, advanced practice nursing, PT, OT, counseling, our professions, EMS, and psychology. And then on top of that, there's, I think, another 5 that are kind of in the process right now. So there's going to be a teaching compact, dentists and dental hygienists are working on a compact, physician's assistants are working on a compact. So it really is kind of like the new wave of licensure portability and access to care.
Right. So we were talking basically specific to telehealth. Are there any other restrictions using this compact in any other type of care? Like, so would I be able to go in person and do direct care? Is there things we can't do in the compact?
No, our compact is meant to do both. So you can be there in person or through telehealth. And
supervision and things like that, or is that you're just basically licensed, ready to go?
Yeah, I mean, if the state has some peculiar thing, in their Practice Act, then you still have to follow the Practice Act of the state where your client is located. So you still have to be aware of what their laws and regulations are. And if they have any limits on the scope of practice, you still have to be aware of all of that. But this is just really an easier pathway to practice, an easier way to get a license.
Okay, great. Okay, let's see here. Let's see. So yeah, so Elena said, great progress. Is there anything else I can do to help in Iowa? We kind of have been going over this. Because of fingerprinting issues, I can't seem to license anywhere new lately. So it looks like we answered her question. So fingerprints are just basically, you get fingerprinted, that's fingerprinted in one state, it gets in the database, right? Right.
And in Iowa, we're actually waiting for them to, so it's already passed in Iowa. We're just waiting for the bill to be concurred on in the Senate, and then it will pass. And so we're expecting that to happen really at any time. So Iowa could be our 19th state very soon.
Wow, that's awesome. So how many states do we have close to getting there? We have Iowa and any other states that might be coming on pretty soon?
We're working really hard in South Carolina, Tennessee, Minnesota, and Missouri. So those are potentials for passage this year.
Okay, awesome. That's amazing. That's great. it's so good to hear. That will just open up a lot of job opportunities for us as well. The most important is care, but it just opens up marketability and so many things.
I know there's been a fear of, we don't want people coming and taking jobs in our state, but you seem to forget you can also go out and take jobs anywhere else. So it kind of works both ways.
Right. I was thinking of that as well. Sometimes the need can drive up pay, but when you have so many states and it's just such a high need, I think it's a great thing.
Mm-hmm.
Well, I can't think of any other questions. We've really kind of drilled you pretty hard, and you've done really well. It's such a amazing thing, and it's happened so fast. I remember when it just started, and that's why I wanted to get you here, because I was looking at the website and I thought it was really neat. But you've done really well, and I can't think of anything else. Do you have any questions for us speech pathologists, or anything that you can tell the group, or anything like that?
No, just thank you for the jobs that you do. And working for ASHA, I really appreciate our members, and really appreciate the work they do, and really appreciate the fact that it was you guys that pushed for this. It was your idea, and we just kind of took it and ran with it. So we're glad that it's going to be coming to fruition soon, and everybody can take advantage of it.
That's awesome. Yeah, for me, it's great to even get somebody from ASHA to talk to, and I think it's great for everybody, all the people in the group, to hear someone directly involved. It's great.
Well, again, thank you for running your page and keeping everybody updated.
Yeah, thank you. Well, we'll keep in touch, and hopefully other people can watch the video and learn how they can directly communicate with their legislators and help you out.
Great.
Okay. All right. Well, you have a great night, and
thank
you, Elena. Thank you, everybody. Okay. Bye-bye. Good night.
Bye.